Hi, my name is Emily Gagne, and the theme of this week's readings is Becoming a Reflexive Ethical Practitioner. From this week's readings, I chose to discuss the article Self-Reflection in Critical Social Work Practice, Subjectivity and the Possibilities of Resistance by Barbara Heron. In this article, Heron discusses the needs for students of social work to learn to analyze how, quote, issues related to power and oppression infiltrate their interactions with clients and their own connectedness to these issues. For example, how power and oppression shape their sense of self and their approach to practice. End quote. Heron brings up a good point that self-reflection is important and necessary in order to understand these dynamics. As human service workers, we have an ethical responsibility to be self-aware. Understanding one's own relation to power helps them to be a more self-aware practitioner. When one is unaware of power dynamics and their relation to these dynamics, then they will unconsciously react based off of systems of power set in place. Awareness of power dynamics will help practitioners to have a reflexive reaction to act based off ethical frameworks. Heron shares that, quote, reflexive knowledge or self-reflection is seen as key to a structural social work practice in that such reflection opens up knowledge about our identities and our location within the social order. End quote. Heron touches on the fact that there is a power inequality between the helped and the helper. Anyone who works in the confines of a helping relationship must be aware of the importance of being self-aware of power dynamics. Heron shares that it is important not only for human service professionals to understand their social location as to where they stand in terms of privilege, but also going deeper into examining the relations of power amidst those we work with and the effects of those dynamics. Why do we react the way we do, and is it contributing to oppression? These types of reflective questions are so important to begin to be self-aware in our decision-making processes. The more self-aware we are, the more intentional we can be. It takes intentionality to break the mold of reacting based off of social structures already set in place. This intentionality can move us from working out of oppressive frameworks to working out of ethical frameworks. Heron shares that social workers who reflect deeper on their interactions with clients, quote, will be moving away from claims to innocence and instead acting more effectively to refuse their continued participation in, and hence the perpetuation of, interlocking systems of oppression. Thus, they may become more truly anti-oppressive social work practitioners. End quote. One current event I felt tied in with this week's article is the impacts of COVID-19 and how it has disproportionately impacted minority groups. An article titled Health Equity Considerations in Racial and Ethnic Minority Groups from the CDC shares how health and social inequalities embedded in our society have caused racial and ethnic minority groups to be at a higher risk of getting COVID-19. There is more and more evidence that these people groups are disproportionately impacted by COVID-19. The article shares that this is due to inequities and many social determinants of health amongst these groups of people. These inequities include discrimination, access and utilization of healthcare, occupation, education, income, wealth gaps, and housing. Responses to COVID-19, including school closures, workplace closures, and social distancing, have had unintended negative impacts on many racial and ethnic minorities. The structures in place in our society are contributing to oppression amongst these groups of people. As human service professionals, it is important we are aware of the structures set in place which contribute to oppression, and we must be reflective on how we may be contributing to this oppression during this time. Taking into account a deeper worldview of our position in terms of power and privilege is important to bring equality and stop oppressive patterns. As human service professionals become more reflective and self-aware, we can begin to understand how we play a role in perpetuating inequalities. Once this is achieved, we can begin to break the mold of cyclical oppression.